So my first appointment with Dr. Maskin, it's funny, I had always gone to doctors where, I thought maybe I'd be there for an hour. But when I called ahead, because I was coming out of town, just how to prepare, they're like, he's gonna spend a lot of time with you. So I was like, okay, great. How much time should I allocate? They're like, it could be throughout the day, plan, block my day. So I was pleasantly surprised, kind of intrigued what exactly that entailed. So, but immediately, the whole entire staff, very warm and welcoming. I mean, when you're on this journey and you've gotten to the point where it's affecting your life, or from a physicality standpoint, from a, almost, creating this sense of anxiety because you just feel like every day you're having a hard time getting through your day because of the pain and what's going on with your eyes. I felt instantly a sense of at least relief because everyone here understood what I was going through. So that was definitely a comforting place to be. Upon meeting with Dr. Maskin, he did an extensive intake process. It wasn't just about my eye. He really looked at me just from a holistic standpoint, what my medical history was, what were things that could create some of those comorbid factors that could not only be, yes, the Meibomian gland piece is a part of what might be going on, but here's some other things that could be going on. So I just really appreciated the depth and time that, a specialist like him took, investing in my health, because I at no point felt rushed at all. So after the intake, the team did a series of tests, very basic, just looking at my eye, looking at my tear film, just looking at all those different pieces. And then they even sent me to do my own Meibomian, sorry, that's never rolls off the tongue well, as well as then the confocal the confocal, and from that, I was able then to be walked through. What I really appreciated was the, being able to see what was going on, but then the detailed explanations behind it. Because again, I had some limited knowledge from where I had been and came about, there's an issue, but here's what we can't do to treat it. Versus this seemed like a very transparent process, like here's what's going on. I'm going to show you and then I'm going to walk you through what exactly is going on here. And then I'm going to make tailored recommendations based on what I think would best benefit your case. This wasn't, this is this, so then you do this, because I felt like that's kind of what I had been. Like, this is level 1 treatment, level 2 treatment, whereas this I felt was much more individualized and tailored to what was going on with me. So after doing, the extensive testing, it was deemed necessary that same day, which again, I came here for relief. So I was so appreciative to have, the doctor willing to do some of these in-off procedures on me. So I had the intraductal Meibomian gland probing, where he, numbed me and went through and did the probing, as well as then doing the steroid injection throughout my eye to help reduce any of the inflammation that they saw, based on my case. And then following that, something that actually I had been misdiagnosed prior to, that I had been previously told there was nothing wrong with my watery tears. Whereas here, after doing testing, I was told that I had 0 tears. And I was like, is that possible? And, I learned, yes, that's possible. So Dr. Maskin then made the, decision, which I agreed with, that we should look at doing some level of cauterization to my tear ducts to preserve the tears I have, versus plugs, which, I had read about, and I agreed that, there can be a lot of challenges that arise with those. So, I felt comfortable given the extensive time that we spent together that day and the detailed knowledge that I knew he had now about me, as well as his background, to where I was like, okay, this is something that we need to do. And, was, able to do this all in one visit, which was actually incredible. And then was able to be seen 1 week post to just get, a baseline of, okay, here's how now you're looking 1 week after all these different treatments.